Hello friends, let's start. And as you know, today's topic is listening. We'll be looking into the tips and strategies, and our mission is to make learning easy and to make you fall in love with OET. Let's see how we can crack it easily and enjoy doing it. Without doing hard work, we always stand for smart work and patience. Have patience and do smart work. Channel, if you're watching on YouTube, consider subscribing the YouTube channel and give us a thumbs up if you like the work, and please do share so that we reach out to many more people. So hope you are ready for the journey. Let's jump into the session.
Yes, Father.
So we'll go. So OET 2.0. So listening part A, key skills. As I always used to tell you, always aim for target for A grade, 450 to 500, minimum 450, so that you are safe in your practice. And that's the biggest enemy for your failure, or most of them fail because they target for B grade and they happen to reach 340, 330 or 320. So always target for 450, so you are safe above 400. It's a patient-led dialogue, which means the answers, most of the answers will be from the conversation, from the part of the patient. So patient will be giving the answers. So you'll have, for the answers, you'll have to listen to the audio from the conversation from the patient. And definitely you have the side headings or the clues from the questions being asked by the other person, doctor or whoever, the professional. So 30 seconds to read the 12 questions before the audio begins with a beep sound. Golden seconds to predict, anticipate, foreseeing. And as you know, definitely first method, which is applicable both for reading as well as listening. And write the exact word or phrase as given in the audio. Don't change the word or form of the word. Write the exact word. Beware of paraphrasing in the question statement. Usually they may not give you the same thing as it is, so you'll have to beware of the paraphrasing. And beware of synonyms and synonymous language. These are the major things in your listening part A. And if you are competent with paraphrasing, definitely we will be competent in synonym and synonymous language, because paraphrasing includes synonym and synonymous language. And today we'll be mostly focusing on predicting as well as paraphrasing, because other things I have dealt with earlier. Typos means spelling mistakes, minor mistakes are okay, but it should not be distorting the meaning or changing the meaning or pronunciation. There should not be a big distortion in the meaning or the pronunciation. So minor spelling mistakes are not penalized. And 3 possible answers, you have to choose the best answer, not the right answer, the best among the 3. There may be 1 or 2 will be exactly the same right answers, but you have to choose the best answer. And color in the circle to mark your answer that's known to you. Listening strategies, prediction or anticipation. And second one, beware of paraphrasing, and beware of synonyms, and beware of synonymous language, beware of collective words. Normally, if you know how to predict and if you know paraphrasing, most of the things will be sorted out. And listening for, what should you listen for? As normal, you have to listen for scale expressions or synonyms, synonymous language, paraphrasing, collective words, comparison, contrast, adjective, chronological or expressions or time expressions, negative meanings, emotions or feelings, names of condition, device, place, disease, something of that sort. So these are the things you have to listen for. And listening strategies, look at the contact extract 1, questions 1 to 12. You hear an optometrist talking to a new patient called Aiden Fitzpatrick. Okay, for questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes. As I said, those are the 30 seconds which are golden seconds to predict or anticipate or foresee or use the first 2 steps of first method. How to use the 30 golden seconds? First of all, ask yourself who is speaking. Here in this listening, it is optometrist, and who is he speaking with? There is a mistake, word doubling the word, sorry for that. And he is speaking to the patient named Aiden Fitzpatrick. And topic, what is the topic? He is speaking about the vision or blurred vision. The issue is, or the kind of problem is vision. So subheadings, what are the subheadings? Which gives you the sequence: symptoms, background details, medical history, next steps. These are the 4 subheadings which you will see. That we are going to deal with all these things. That's why I'm going a little faster. These are the basics which you already know. Now the problem issue here is one has Aiden has blurred vision. There is some problem with your sight. So could you tell me, if somebody comes to the hospital with a problem with his sight, what will be the symptoms? If you have some problem with your, or if you are wearing a specs like me, and if you have forgotten to take the specs, what will be the symptoms that you show or the signs that you exhibit?
Blurred vision.
Okay, vision will be blurred,
Difficulty
which means I am not able to read, right? Blurred vision. Yes. What else?
Trying to struggle to read.
Yeah, struggle to read. How do they struggle normally? What are the?
They will keep close
Yeah.
to this book or something. They will keep close.
Okay, they will keep closer. They will bring it closer. Okay, then.
Sometimes headache.
Yeah.
Need more light.
Need more light. They will put on all the lights possible, so to see that there is a better light, so that they can see better. Then.
Headache also associated with
yeah. Normally, when you have no sight, you will be looking very staring at the text and reading, and you gradually you will have a headache. When you have a headache, what will you do?
Painkiller.
Yeah, you will use painkiller. Could you give me the name of one painkiller normally used by all?
Ibuprofen.
Paracetamol, ibuprofen, something. Okay, this is called prediction. So this text will have 4 side headings. First part speaks about symptoms, where you said all these, and definitely you will see these predictions. How many of them are correct? As you go into the audio, you will listen to. Then after that, background details of the the patient. Then medical history of the patient. Medical history, his previous medication or other things. Next step means management or monitoring. That's a normal sequence I told you in all the. So this is the way the audio is given. Symptoms are given 1, 2, 3, 4, 5. Maybe more are there, but I have not given because of the space. And then you have background details. Then you have medical history and the next step. Okay, these are the headings. Now, could you just identify the disease? Maybe, okay. Looking at the symptoms. First column, symptoms of what?
Vision problem.
Vision problems. Second one. Heart problem. Yes. Third one.
Pregnancy.
Exactly. Pregnancy. Fourth one.
COVID-19.
COVID-19. Exactly. You see the symptoms. You know the symptoms. Being medical professionals, these are by heart for you. You really know them. Okay. I have not given the title, but I'll show you the title now. Symptoms of what? See. Now these are the symptoms. Yes. Vision problem, heart attack, pregnancy, and COVID. Now you know who are the specialists as well. So at the very introduction, you will be they will be introducing who is speaking or who is here, to whom is he speaking, and normally they will say what is the condition or the problem they are facing, or in the next step they will explain the problem. Both is fine. Okay, so this is called prediction. Where as soon as there is something symptoms, then they say there should be. Okay, yeah, just we'll listen to part A just once.
You hear an optometrist talking to a patient called Aidan Fitzpatrick, who has been experiencing blurred vision.
Hi, Aidan. I'm Dr. Solkeld. Could you start by telling me about what's been going on with your vision?
Sure. Well, I guess it must have started a while ago, but I didn't really notice it properly until about 2 weeks ago.
Right.
I was working in my garden and I noticed that I was having a hard time reading the instructions on the gardening products that I just bought. I normally stick to the one I've been using for years, but I thought it'd be nice to try something different. Anyways, it kind of felt like everything was fuzzy around the edges and I just couldn't see the letters clearly.
Good.
After talking to my daughter, she mentioned that I've been using increasingly more light to read at night and even pulling things closer to me to read.
Good.
I hadn't even noticed. So I went out and got some of those glasses they sell at the pharmacy and they helped, but my doctor said that it'd be better if I came to see an eye doctor. Well, they made things less blurred anyway, I guess. My vision's still not crystal clear or anything when I use the glasses, but I wasn't really expecting that. I still notice that I'm squinting to see things.
Right.
It's mostly when I'm trying to read something close up, like small writing. I'm better when things are at a distance. I don't know if it's related, but I've also noticed a pretty persistent headache. I guess it's kind of at the sides of my head, I suppose. It comes and goes, but it's definitely worse when I'm having trouble seeing something. When it gets really bad, I just take a fast-acting ibuprofen, and that tends to sort it out.
Ever had any vision problems before?
When I was little, at some point in elementary school, I think I had glasses, but I'm sure I broke them and we just never got round to having them replaced. My brother has glasses that he's been wearing for years. I don't really know a whole lot about what's wrong with his eyes. Maybe he's short-sighted. Oh, but that reminds me. My brother thought I should mention that a couple of months or so ago I was pretty ill. I was suffering from sinusitis. And anyway, I left it pretty late to go and see the doctor about it. Kind of thought that it would just sort itself out. Anyway, it lingered for a while, so when I told my doctor, he gave me some antibiotics and it cleared up pretty quickly after that. Well, for the most part, although I still feel like I have a cold. Other than that, I've been in really good health for the last few years. I take my health really seriously. I'm not sure if the doctor told you, but I used to be quite overweight. But I lost it all after a bit of a wake-up call some years back. I had what you guys call a myocardial infraction. It was pretty scary, and I was quite overweight at the time and really stressed out about my job. Since then, I've made a real effort to look after myself properly.
I'm glad to hear it. So, in terms of your blurred vision, what do you think might work for you?
Well, I don't particularly like the idea of wearing glasses all the time, but touching my eyes freaks me out, so contact lenses are definitely not an option. I guess the best thing might be to just have glasses that I wear all the time, so I don't keep forgetting to put them on when I'm out somewhere, not at home. I've actually never had an eye test, so I should probably schedule one of those as the next step.
I think that sounds reasonable. Let's do some tests to check out your eyes and go from there.
So blurred vision, you should visualize these symptoms as they read. No more light. Something squinting when you are not taken, you are using your specs or you lost your specs. Squinting eyes and specs, headache, ibuprofen, the solution for headache. And sometimes you bring very closer when you can't see, right? You have the phone or the text. Can somebody just read these?
Symptoms. First to notice difficulty reading 2 weeks ago. Describes his vision as dash. Has difficulty reading printed letters. Needs increasingly dash to read in evenings. Found he was having to hold objects closer to see. Purchased glasses from dash. Often finds that he is dash his eyes even when wearing glasses. When struggling to see, can also experience dash. Aiden treats pain with dash fast acting. Background details. Wore glasses as a child. Brother also wears glasses, possibly dash. Medical history. Recently suffered from dash. Treated with antibiotics. Still experiencing symptoms of dash. Lost excess weight following a dash. Describes as wake-up call. Next steps. Isn't willing to wear dash. Must be given dash. Never had one.
Okay. Is it possible that you can fill in here? What is the described his vision as? And definitely think whenever there is described and as, that will be compared to something. You describe something as something. Okay? One thing with another thing. Okay, needs increasingly dash to read in evenings. When you have eyesight, yeah, increasingly you need more light. Yes. Then purchase glasses from, so there will be a place, right? You purchase glasses or specs from somewhere. So that gap should be filled with one place. For example, you purchase rice from grocery shop, right? You purchase medicine from medical shop or pharmacy. So also glasses from. So one place, that's what you scan your questions. I'll show you how to do it. And often finds that he is dash his eyes. Doing something with eyes, right? He is dash his eyes means some action of the eyes. Was there any word which was action of eyes? You remember? Okay. And when struggling to see, yeah, can also experience something. Experience what?
Headache.
Yeah, headache. And as soon as you have a condition, next step is treatment, right? When you have a headache, iron treats pain with dash, one tablet or some pill or something like that. Fast acting pill or tablet. So, you know, that's how you screen the 30 seconds, no? Wore glasses as a child, brother also wears glasses. Possibly there is a modal verb. There will be some modal verb in your audio instead of possibly. We'll check into it. And medical history, recently suffered from dash. Medical history means, you know, previously what was the issues that the person had. Suffered from some disease, right? Suffering from some disease, some condition. You see, immediately you have treated. Here also, headache treated with some other tablet. Here, suffered from something and treated with antibiotics, still experiencing symptoms of another sickness, symptoms of another condition. See, that's how you read, you scan the questions. Lost excess weight following a dash, following some difficulty, some disease or some issue, right? You don't lose weight unnecessarily without any reason. So there is some reason for loss of weight. And next steps means what is the next management? Isn't willing to wear dash. Is not willing to wear either specs or contact lenses. There is a description on that. Must be given dash. He says he was never done. That's negative meaning. Okay, let's look into it. Okay, we will not take the second part now. Scan the question statements for STEM words. See, these are the STEM words which you have to scan. Vision, as I told you, describes his vision as, describes vision as. And this will be there even in the second segment also, even in the second extract, you will have almost same. So there is a comparison with something. Okay, and needs increasingly. There will be a synonym used or synonymous language used for these words. To read in evenings, increasingly, already you know. Purchase glasses from a place, a shop, some name, right? Here one noun should be there, increasingly dash to read, some noun. Here, purchase glasses from, as I said, grocery from, purchased fish from, purchased snacks from. So the gap should be some place, shop or some place. Okay, name. Often finds that he is dash with his eyes, means a verb, action of eyes. Something with doing with done with the eyes. So verb will be, action word will be there. When struggling to see, can also experience dash. So also experience some, usually what you experience when you are sick, some pain possibly, right? Aiden treats pain with treatment always with some pill or medicine, something like that. So, you know, a medicine name will be there. That's what I said, what you have to listen for. You have to listen for name, you have to listen for feelings, emotions, or you have to listen for synonyms, paraphrasing, all those things. So you see, blurred vision, need for more light, specs, squinting, headache, ibuprofen. We did not take the name of the medicine, but then it's ibuprofen here. Only squinting we did not get when we predicted, right? So can you put in these words here?
First one blade.
No, first one was something else. It's okay. Second one, go to second, just from prediction is. Increasingly, it is comparison. There is a comparison.
Need
What?
Need for
Need
more
more.
light.
Okay. Third one.
Pharmacy.
Yeah, for pharmacy, we did not write that. Next one, he is dash. Squinting. Okay, experience. Also experience. Headache. And treats with.
Ibuprofen.
So vision as fussy. Did you hear that? Described his vision as, I was seeing everything as fussy. Fussy means it was not clear. Then second one is increasingly more light to read. Purchase glasses from pharmacy or the pharmacy. The bracket is given. If you write pharmacy, it is right. Even if you write the pharmacy, both are right. Okay, that's why the bracket is given. Sorry, sometimes there will be 3-4 brackets. Yeah, either you can use any of them or all of them, or you can write without those also. There you will not be penalized. And he is squinting with his eyes. and is also experience a persistent headache or a headache or persistent headache or whatever. All these things are right, and treats with ibuprofen. Okay. See, now the seventh one, wear glasses as a child. I am taking a little faster for you because these are familiar for me. Brother also, I'll be just describing you how to take it over, and I will analyze the text script. Brother also wears glasses possibly. The word says there in the text, it says maybe short-sighted. Okay, you have a model here. Maybe is a model used in the audio, and a scale, short, a scale being used. Recently suffered from, when you're suffering from a sickness, right? Condition. Sinusitis is a condition, a name given. Treated with antibiotics, still experience symptoms of another sickness or condition, name, that is cold. Lost excess weight following dash, myocardial infarction, or MI also is right. If you write MI, that will also be considered right. Describes as wake up call. See, again, describes as comes here as a comparison. So next one is, isn't willing to wear contact lenses, negative meaning, or the name given. Contact lenses is the name, negative meaning. In the audio, they have given negative meaning. Okay, never an option. They said never. Contact lenses will never be an option for me. Must be given an eye test. This you have done. That's why I'm going fast. So scan the text audio for strategy. Sorry, scan the script now. Script of the text of the audio. So let's check how it goes. Okay, now is it possible for you to play a game?
Hi, Aidan. I'm Dr. Solkeld. Could you start by telling me about what's been going on with your vision?
Sure. Well, I guess it must have started a while ago, but I didn't really notice it properly until about 2 weeks ago.
Right.
I was working in my garden and I noticed that I was having a hard time reading the instructions on the gardening products that I just bought. I normally stick to the one I've been using for years, but I thought it'd be nice to try something different. Anyways, it kind of felt like everything was fuzzy around the edges and I just couldn't see the letters clearly.
Good.
After talking to my daughter, she mentioned that I've been using increasingly more light to read at night and even pulling things closer to me to read.
Good.
I hadn't even noticed. So I went out and got some of those glasses they sell at the pharmacy and they helped, but my doctor said that it'd be better if I came to see an eye doctor. Well, they made things less blurred anyway, I guess. My vision's still not crystal clear or anything when I use the glasses, but I wasn't really expecting that. I still notice that I'm squinting to see things.
Right.
It's mostly when I'm trying to read something close up, like small writing. I'm better when things are at a distance. I don't know if it's related, but I've also noticed a pretty persistent headache. I guess it's kind of at the sides of my head, I suppose. It comes and goes, but it's definitely worse when I'm having trouble seeing something. When it gets really bad, I just take a fast-acting ibuprofen, and that tends to sort it out.
Ever had any vision problems before?
When I was little, at some point in elementary school, I think I had glasses, but I'm sure I broke them, and we just never got round to having them replaced. My brother has glasses that he's been wearing for years. I don't really know a whole lot about what's wrong with his eyes. Maybe he's short-sighted. Oh, but that reminds me. My brother thought I should mention that a couple of months or so ago, I was pretty ill. I was suffering from sinusitis. And anyway, I left it pretty late to go and see the doctor about it. Kind of thought that it would just sort itself out. Anyway, it lingered for a while, so when I told my doctor, he gave me some antibiotics and it cleared up pretty quickly after that. Well, for the most part, although I still feel like I have a cold. Other than that, I've been in really good health for the last few years. I take my health really seriously. I'm not sure if the doctor told you, but I used to be quite overweight. But I lost it all after a bit of a wake-up call some years back. I had what you guys call a myocardial infarction. It was pretty scary, and I was quite overweight at the time and really stressed out about my job. Since then, I've made a real effort to look after myself properly.
I'm glad to hear it. So, in terms of your blurred vision, what do you think might work for you?
Well, I don't particularly like the idea of wearing glasses all the time, but touching my eyes freaks me out, so contact lenses are definitely not an option. I guess the best thing might be to just have glasses that I wear all the time, so I don't keep forgetting to put them on when I'm out somewhere and not at home. I've actually never had an eye test, so I should probably schedule one of those as a next step.
I think that sounds reasonable. Let's do some tests to check out your eyes and go from there.
Okay. See, now this is also exactly a practice for your role play card, speaking. How to start a speaking. Here you have maybe like, how to start. For example, how the professional starts here. That's how you have to start, right? You have like, I am Dr. Sakel. So immediately you start with the name, introducing yourself, and what's been going on with your vision. So what are the problems? So what are the symptoms? What are the symptoms that you have? What are the complaints you have? So as I told you in the beginning, they have the special this one, the issue given or the specialist mentioned. You hear an optometrist talking to a patient called Aiden Fitzpatrick. This one is very important. As soon as you know optometrist, you know they are going to speak about vision, right? So you start predicting in your mind. All these predictions happen very, very naturally and casually. You need not go by step, all those things. As soon as you think of blurred vision, you know, you imagine a guy with a soda glasses and staring at you and he can't see the things properly, all those things. Okay. So then, you know, all this felt describing was fussy around the edges. So anyway, it kind of felt like the feelings and emotions always will be answers. Increasingly, you know, there's an adjective, more light, there is a scale. Glasses they sell at the pharmacy. Okay, normally, like, you know, we have different places where glasses are sold in India, but normally it is sold in pharmacy. That's why it is mentioned there. And I still notice squinting, the action of the eyes, but there's a contrast. I also noticed a pretty persistent headache. After the contact expression, usually I told you, normally the answer appears. And pretty persistent headache. So you can write a headache or a pretty persistent headache, both will be right. And that is being treated by ibuprofen. This is the sequence you have to see. As soon as there is a medicine or a issue or a condition, then next one will be the treatment part. Okay, diagnosis, treatment, diagnosis, then you have medication. Okay, so ever had any vision problems before? The background details, no, medical history and background details. So you see, I said maybe he is short-sighted. Maybe is the model will be used. Synonym used is possibly, that I will be showing you. I was suffering from sinusitis. You know, normally all these names or the conditions or the modal verbs or those contrasts will be the answers. And I have a cold, suffering from symptoms of cold, it is said in the question statement. But again, one contrast here, as soon after the contrast, what happens, what comes is the answer. Wake up call is the clue given there, myocardial infarction. So after the contrast, there is the answer. So what do you think might work for you? Next step. In the question booklet, it is given next step. So he says, I don't particularly like the idea of wearing glasses, but say there is a contrast. So the idea is changing. I don't like, but touching my eyes freaks me out. So contact lenses are definitely not an option. Negative meaning. Okay. Though I don't like wearing glasses, I don't even, 100% more I dislike contact lenses. See, there is a contrast. So what is he looking for? I guess the best thing might be to just have glasses that I wear all the time. So I go for glasses, not contact lenses. That is the answer there. And I have actually never had, that is given, clue is given in the bracket, never had one, an eye test. So must have an eye test is the answer given. Okay, I'll be giving you the paraphrasing of these things. Okay. Can you see my screen?
Yes, Father.
Yeah. See, been going on with your vision, and this is the same thing with the question. I am just trying to connect difficulty reading. That is the main symptoms, and the first notice the difficulty reading. That is the concept, you know, vision and reading difficulty. In the first part, symptoms, the concept is or focus is vision and reading difficulty. So reading difficulty is described and explained. So first answer says it was looking like fussy. The printed small letters were looking fussy. So describing how it looks. Then difficulty reading, printed, see, difficult reading, all this repeatedly used. See, reading, hard time reading, and couldn't see the letters means difficult reading. increasing more light to read at night. So again, difficulty in reading. That's being repeated. What is the main concept? As I told you, in all these subtests, you have to focus on the main focus or the concept of the paragraph or the audio or speaking or listening. Okay. And see, difficulty reading, hard time reading, couldn't see the letters, felt is feeling. Whenever there is feeling or emotions, next will be the answer. And see, synonymous language used, hard time reading, difficult means difficult reading, couldn't see the letters. These are synonymous language, not the same words used, but different words used to express the same meaning. Okay, see, these are different things being used. I have just highlighted fuzzy around the edges, and the same thing, but I have highlighted. I'll show you in the columns how they have used the. See, what's been going on with your vision is the side heading. No, what's the symptoms is mentioned in what's been going on with your vision. Hard time reading the instructions on the gardening products that I had just brought. See, difficulty reading printed letters. I'll show you. Felt like everything was fuzzy around the edges, couldn't see the letters clearly. Had been using increasingly more light to read at midnight and pulling things closer to me to read. So what's been going on with your vision? So these are the 5 things, one after another, explained in the first portion of the audio. Okay. And as we get back to this one, I'll show you how the paraphrasing is being used. Okay. See, paraphrasing in the question and text. This is the thing that you have to practice in your listening part A. You know, there are 24 marks in the part A. If you do well in that, the listening score will be very easy for you. See, the question statement says, first noticed difficulty 2 weeks ago. What is the paraphrasing used? I didn't really notice it properly until about 2 weeks ago. Same thing expressed in different ways. That's why we call it paraphrasing. And I'll tell you, listening part A is mostly the same thing. If you are able to be competent in paraphrasing, you do it very easily. See, first notice difficulty reading 2 weeks ago. Same thing expressed in the text is, I didn't really notice it properly until about 2 weeks ago. It means difficulty reading. Okay, so reference is there. See, other one is describes his vision as fuzzy. And here in the text, it is said, it kind of felt like everything was fuzzy around the edges. Same thing mentioned in different ways. And the question statement says, has difficulty reading printed letters. And the text says, I just couldn't see the letters clearly. See how beautifully they have paraphrased. And in question, it says, needs increasingly more light to read in evenings. In the text, it says, had been using increasingly more light reading to read at night. Here it is, read in evenings, read at night. Synonymous expressions, increasingly same word is used, more light, the scale is being used. You know, here everything says needs increasingly. This is a factual statement. Here the pronoun is used, he is explaining. See, I'd been using, I just couldn't. He has difficulty reading printed letters. So here it is said in factual statements, here it is said in first person. He is explaining, and this one here it is stated as factual statements in the questions. And found he was having to hold objects closer to see. See, the text says had been, or the audio says had been pulling things closer to me to read. Found he was having to hold objects closer to see. I'd been pulling things closer to me to read. See, here I'd been means first person. I am explaining. The patient is explaining, but in the question statement, the third person used. Found he was having to hold objects closer to see. The reported speech is being used in all the question statements. Okay, whereas here it is first person being used. This is what you have to understand. And as you just scan the questions for the first 30 seconds, this difference you have to make out. So when you listen, it will be very easy for you to grasp the answers. See, purchase glasses from the pharmacy. You know, see, purchase the glasses, sell at the pharmacy. Even when, still, expressions being used, synonymous expressions. Now you see that part. The next question, purchase glasses from the pharmacy. I went out and got some of those glasses they sell at the pharmacy. Purchase glasses from the pharmacy is the question statement, paraphrasing of this text in the audio or this sentence in the audio. I went out and got some of those glasses they sell at the pharmacy. They sell at the pharmacy, I purchased. Okay. And the next one, often finds that he is squinting his eyes even when wearing glasses. That's the question statement. The text says, I still notice that I am squinting to see things. I still notice that I am squinting to see things. Often finds that he is squinting his eyes even when wearing glasses. So these are the paraphrasing. Now you see, as I said, name, contrast, adjective, and you have comparisons. Here again, ibuprofen is the name of the medicine, and a pretty fast acting is the adjective. Pretty persistent is the adjective being used. Headache is the name of the disease, but is the contrast. So these are the clues that tells you here is the answer. Paraphrasing, the next one. See, question says, when struggling to see, can also experience a pretty persistent headache. But the text audio says, I have also noticed a pretty persistent headache. It's definitely worst when I am having trouble seeing something when struggling to see. So same thing being paraphrased. You have to, that's what I said, when you practice, you have to write down these paraphrasing expressions. Write down the question statement, the bullet points in the question statement, and write down the same thing explained in different way in the audio or the script. So make a book of those things. In the beginning, you'll have to do that. After that, you know the same things being repeated, you will know exactly how to do it. And Aiden treats pain with ibuprofen and fast acting. Was the clue given in the question. And I just take a fast acting ibuprofen, and that tends to sort it out. Okay, treats, tends to sort it out is treats. So Aiden treats pain with ibuprofen. I just take a fast acting ibuprofen, and that tends to sort it out is the text. Okay, or the audio.
You hear a senior obstetrician talking to a patient called Hilary Johnson, who has been referred by her midwife.
Hilary Johnson? Hi. Do come in and take a seat. I'm Dr. Smith, and I'm a senior obstetrician here. So, Hilary, you've been referred to us by your midwife.
Mm-hmm.
I have her notes with me here, but could you tell me in your own words why you've been referred?
Oh, yeah, no problem. I think I've been referred to you because the midwife said she found some glucose in my urine sample and was worried about diabetes. If I understand correctly, I could have diabetes during my pregnancy, but if I do, it's not likely to continue after giving birth. I've noticed that I'm craving sweets and cakes all the time at the moment, and I've just been letting myself eat whatever. So I've put on a bit of weight, and I don't think it's all just baby weight either. I've never had a problem with diabetes before, and I'm hoping it'll turn out to be something else. My aunt actually has type 2 diabetes, but she's always eaten a lot of sugar, so I think that might be a factor. She just controls hers with diet now and doesn't have to take any medication.
Oh, okay. Thanks for letting me know. I see from your notes that you're 24 weeks pregnant now. How has your pregnancy been up to now?
Oh, I have been so lucky. I got the usual sickness early on. Well, you know, stomach pain, but not actually being sick. I think that's pretty common. And it's settled after the first trimester. I've been taking some medication because I also had pretty horrible heartburn.
Right.
And it seems to take care of the problem. And also I've started to get a bit of back pain in the last week or so. I'd say it's like a throbbing feeling, but other than that, I've been pretty fortunate. I suppose I've been gradually getting more and more tired since the start of my pregnancy. I've just put it down to the extra energy my baby needs. But it could also be because I haven't been sleeping very well. Also, sometimes the nausea stops me from making something healthy for dinner, which is annoying because I know I need to eat healthily. I take a prenatal, though, to make sure I'm getting the right nutrition.
Well, it seems like you're managing to deal with most of your symptoms well.
Yeah, this is my first pregnancy. And to be honest, I didn't have a clue what to expect. But so far, so good. It's only this glucose thing that's got me worried. I imagine it's just a one-off, but I guess it's best to get it seen to.
Certainly, and I'm pleased you're here so we can get things sorted. So we'll need to book another appointment to carry out some tests.
Okay, so when will I have to have this? Because I'm a bit busy at work at the minute.
Well, ideally as soon as possible. Can I ask what you do for a living?
I'm a high school teacher, and it's just getting to that time of year when the kids are gearing up for their examinations. So I can't afford to be taking too much time off during the day. I'm actually a little bit stressed at the moment as well. I've had to do a lot more work over the past few weeks. I think it's just that time of year. I've been a teacher for 4 years now, so I'm starting to develop ways of coping with the madness. With that in mind, if our next appointment could be at 5-ish or later, then that would be perfect.
No problem. Just make sure to let the receptionist know your preferences. When we find sugar in preliminary tests, we offer an oral glucose tolerance test, which is what we'll do when you come in next. Do you know what that involves?
Well, I asked a few of my friends about their pregnancies, and my friend Beth said that she had the same thing and told me about that test. She said that she had to come into the hospital and drink a sugary drink and then have a blood test to tell if she had diabetes. Is that right?
Yeah, that's pretty much it. Here's the leaflet that explains the test so that you can have a read about it when you get home. Do you have any other questions for me?
No, I don't think so. I'll go away and read this and wait and see what the test says. Well, thank you for your help today.
You're welcome. I'll see you once we have the results and we can take it from there.
See, the next part is this again, same thing as I told you, how to use the golden 30 seconds. This is the second extract, okay? I'm just fast glancing over it. Who is speaking? You have to understand first, obstetrician, to whom is he speaking to, or who is he speaking with? Hillary Johnson. Topic is, what is the topic? Diabetes. Subheadings, reason for referral, family history of diabetes, pregnancy symptoms, occupation, and next appointment. These are the subheadings in the, see, focus of the audio is this: reason for referral, family history of diabetes, pregnancy symptoms, occupation, next appointment. You know, reason for referral. Why the person is being referred? Okay, they will be speaking about the condition there, right? The disease. Family history of diabetes, which means automatically, you know, as soon as you look at the side heading, you know, they are thinking of family history means whether somebody has diabetes in your family, your brother, father, mother, and something of that will be the answer. Pregnancy symptoms, already we predicted it. Occupation, you know, as soon as they are speaking about what you do for your living, when they ask the person, and immediately the answer is a nurse or doctor or teacher or engineer. So definitely the answer will be particular occupation, nothing else. So from the very side headings, you can predict the answers. Next appointment, when and for what. Okay, what will happen in the next appointment? This sequence you have to keep in mind. See, diabetes structure. Reason for referral. The second extract structure is this. Reason for referral, 1, 2 reasons will be there. The family history of diabetes. Somebody has family, one or two person have the history in the family, diabetic history. And pregnancy symptoms, as we said, 1, 2, 3, 4. Occupation, I said. What will be the occupation? Normally 1. Next appointment. And for what and why. Okay. See, reason for referral. Glucose in indicates risk of diabetes. What will be glucose in what? Glucose in tea or coffee?
The urine or in the blood.
Okay, urine or blood. So you have to just listen to that, right? Describes herself. Again, I said describing something as comparing something. Describes herself as what is something for sugary fruits. Either she hates or she likes or craves, right? Sugary foods. When you have diabetic, either you crave for it or you hate sugary foods. Let's see what it is. One of those should be the answer. That's a prediction. Notice the extra dash, which may be unrelated to pregnancy. Extra something. Extra means notice something extra in the body. Normally, what is extra? Normally, what is extra? Weight. Yeah. Normally, it will be weight, right? You cannot have extra length of a foot or hand or something of that sort. So normally, obesity, the weight is the thing we called extra or too much. Family history of diabetes. Her dash suffers from diabetes. Definitely a person, right? Her father, mother, sister, brother, and somebody. Pregnancy symptoms that we already See, morning sickness, we have already seen in the beginning. So pain in her dash, somewhere there is pain. Dash controlled with medication. The condition is controlled with medication. That, a name of a disease. Recently suffering from backache, described as dash pain. When I taught you on listening about pain, about pain, there are some adjectives being used. So some adjective you will have to see what is being described as, or they compare this as this type of pain, pricking pain or throbbing pain or whatever. Okay, has been feeling increasingly, see again increasingly being used, increasingly dash problems sleeping. Okay, has been feeling increasingly some feeling. As I said, there is feeling means there is an answer. Concerned about diet, taking something about diet. Okay, occupation, I told secondary school teacher, feeling dash. Okay, feeling dash, increased workload. When there is increased workload, what do you feel? You feel happy or tired or exhausted or energetic? Feeling something of that sort. When you have a lot of workload, you know what you feel. That will be the answer. Next appointment will take an appointment. Dash test. They are speaking about a particular test. And means, or it should start with a vowel sound, right? And dash glucose test. Already you know what is vowel sound. Has been given a, so easy, so I don't want you to repeat the answers. Has been given a dash to consult. Something is given there. So a name should be there. Okay. See, this is how you scan glucose in dash, as describes as sugary foods, extra dash, her suffers. So see the words just before and after the gap. Her dash suffers, or someone suffers. Pain in her dash, in her brain or in her stomach or in her head or whatever, belly, wherever, just for some place in her body. Dash controlled with medication. Something is controlled with medication, some disease or some condition. Recently suffering from backache, described as backache, described as pin pricking or something of that sort. We'll have to see what it is. Feeling increasingly dash. Okay, concerned about diet. So feeling. So answer. That's what it is. Take an. Notice those words before and after. An oral glucose test has been given a to consult. Again, means now it will not be a vowel sound. The word will not start with a vowel sound. Okay. Listening part B, key skills. Almost like you have almost 2 minutes each for each question, dialogues or monologues. And maybe you'll have to complete it within 10 minutes, which is an easy task, which I'll let you know now. 3 options MCQs and 10 minutes time. And the question types, it's a gist. You have to understand the gist. General meaning of the text you should understand. And I'll be explaining to you how easily you can understand the general meaning. And gist means who is discussing. You should understand who is discussing or explaining or speaking. Who is the discussion partner, or what are they discussing? These things, like there will be doctors, hospital managers, nurses, anyone. Then also you should listen for the detail. What is the concern? What is the issue? The symptom, reason, solution. So what is the main problem? That also you have to listen, which will be there in the very beginning of the audio. And third one is course of action. What is the solution or course of action taken? What is to be done by nurse, doctor, or manager? These are the things basically in each of these 6 audios. And listening for, as you know, context, main idea, purpose, opinion, and attitude. So you'll be listening for the context. What is the context? In which context are these people discussing something, or someone is explaining in a monologue? And the main idea, you should be able to understand the gist or the main idea and purpose of the conversation or the monologue or the dialogue. So you should be able to identify that. Opinion of the speaker and the attitude of the speaker. These are the basic things you need to understand. And all these of the speakers and details I am not going into now. All these things, as you know, the gist, the strategies you'll have to look into in all the subtests of OET. So, and again, it is question, answer options, then listen, audio, qual method we call it. That's also I'm not going to explain to you. We have in the previous videos uploaded all these details, but just bring into your mind. It should be a question first, then you have to identify the topic in the answer and the stem words in the question, then identify the structure of the conversation, nature of the topic, and focus of the audio or the conversation. Listening strategies focus on the main idea of the communication. As you know, I have explained earlier about the topic sentence keyword, which will help you to understand what is the main idea very beginning of the conversation. Pay attention to signal words used to emphasize key points or show relationship between ideas. Okay, keywords like I said, no, the contrast words or the relationship words or comparison words, all those things. Synonyms, rule out incorrect answers, elimination strategies, select the correct answer. And pre-listening strategies, you have 15 seconds per question. I said golden seconds. Okay, here also it said golden seconds, 15 seconds. That is pre-listening strategies. What should you do before listening? Look at the context. Immediately in the question booklet, you have the context given at the very beginning of the question. So look at the context, notice the structure of the conversation, read the question stems carefully, the main question stems, read the options and notice the differences between the options. Underline keywords, verbs, adjectives, nouns, etc. in the question and answer options. So the context.
You hear a dentist discussing booking problems with her receptionist.
Okay, this is how they introduce the whole concept that you should listen to these instructions and understand the context. And notice the structure or the sequence. Listen for the keywords, signal words, key points, paragraph structure. Okay, if you don't get the answer immediately, skip and go. As I say normally, you can come back later. Okay. Tip 1, focus of each text idea or the topic sentence or the point. As I said, definition, or it will start with a definition or a description each conversation. Then they will explain it. The topic idea will be explained. Then they will give some examples or illustrations about the main idea. They might give us conclusion also. That's the common structure. Okay, so you have a point in the beginning. Now, when they start speaking, they will tell you what is the issue, main issue or the main key point. Then they will explain what is the problem. Then the reasons will be discussed. Okay, this is how they give the structure. If reasons, under reasons, 1, 2, or 3 reasons will be given. And in the question, you will be asked to identify which is the correct reason. Okay, this is how they mention point. A problem will be given. Then what is the reasons for the problem? Then you will have reasons or solutions, whatever. But the structure will be same. Underline keywords. Just listen to this. Now, could somebody read this question for me?
Underline keywords. You hear 2 OET aspirants talking about today's Zoom session for OET aspirants. They think that few nurses have shown interest because there are so many sessions on offer. B, they feel it's not relevant to them. C, it hasn't been publicized enough.
Now, this is the question, okay? And this is our present situation. Today's, just I have taken a sample. This is not the 27th question, today's part B. But now, they think that few nurses have shown interest because few means no one.
No one.
Yeah. If you make it a few, it becomes some of them. There are so many sessions on offer. There are very few participants yesterday and day before yesterday. That was our issue, right? So there are so many sessions. What are the reasons? Reasons. One is there are so many sessions on offer. They feel it's not relevant to them. It hasn't been publicized enough, or it means you have not posted the notice in all the platforms, something of that sort. It's not, I'm just taking it as an example, not the fact. So I told reason first, second, and third, and you'll be asked to choose one reason. So you have to understand this structure. Now you will listen to the audio. Just listen, okay? You have known these 3 options, Once again, I'm telling you, there are so many sessions on offer. Why very few enter or no one enters the Zoom session? One is, there are so many sessions on offer. If you don't attend morning one, evening, there is one, or again, there is a repeat session, something of that sort. Second one, they feel it's not relevant to them. They feel it's not relevant to them because they are studying in different institutes. It hasn't been publicized enough, means we haven't posted the notice in all the empowering groups, or we haven't published it in the main platform. So just listen to the audio and try to understand what is the reason, which is the correct option.
The registration for the OET Zoom session for nurses has been disappointing, hasn't it?
It has, but I am not exactly sure why, because everyone seems to know about the session tomorrow. And we asked Father it to be changed from morning session to evening session to make it easier for nurses to be released from their wards. But apparently, that was not possible because Father has some other schedule in the evening.
Yeah, I'm not convinced timing of the session was the problem anyway. I think once OET aspirants become aware of the real benefits of father's sessions and how it helps them, there might be more interest.
Certainly, it is very important to attend fathers' live sessions, even if the OET aspirant themselves don't actually realize it at present.
Now somebody can read this. This is the audio, script of the audio. We'll just read and understand.
Krishna, the registration for the OET Zoom session for nurses has been disappointing, hasn't it? It has, but I'm not exactly sure why. Because everyone seems to know about the session tomorrow. And we asked Father it to be changed from morning session to evening session to make it easier for nurses to be released from their wards. But apparently that wasn't possible because Father has some other schedule in the evening. Krishna, yeah, I'm not convinced timing of the session was the problem anyway. I think once OET aspirants become aware of the real benefits of father's sessions and how it helps them, there might be more interest. Yeah, certainly. It's very important to attend father's live sessions, even if the OET aspirants themselves don't actually realize it at present.
Now, what is the answer and why is the answer? Which is the correct answer?
B is the answer.
They feel it's not relevant to them. Okay, but other things are also mentioned there, right? Yes, but I am not exactly sure why, because there everyone seems to know about the session tomorrow, which means already publicized, right? They are not saying it directly, but it means so. And but apparently that wasn't possibly because father has some other schedule, and changing the schedule was not possible. A contrast word is this. Then I think once OET aspirants become aware of, so what is the criteria used here? I think, what does it speak? I think opinion of the speaker. That is the opinion of the speaker. So the answer will be the opinion of the speaker, and there might be more interest. So that also tells this opinion is stressed. So might be more scale and modal verb is used to ascertain the option. Okay, this is just for example. You hear two OET aspirants talking about today's Zoom session for OET aspirants. They think that few nurses have shown interest because there is a question, and this is the text we had, script audio. Okay, OET aspirants become aware of the real benefits of other sessions and how it helps them. There might be more interest. See, this is not a text. Actually, we created a text with the present situation, but to make you feel how the opinion questions are framed. Okay, here also in the question, when they say they think, it's an opinion they are asking for, right? The question itself says they think that few nurses have shown interest because they think, because now Krishna is giving the opinion at the same time. XY said, yeah, certainly it's very important to. She agrees with that. So that's why it is the opinion of both of them. They think that. That's why assessing the question and answer options and finding out the stem words is very, very important to understand. So this is they think speaks about the opinion, and few is the scale there because says ask for a reason. Okay, and negative meaning, they feel it is not relevant to them. It is not said directly in the question here, but then it says, I think OET aspirants become aware of the real benefits of other session, but that is given here in the answer option as they feel it's not relevant to them. It's given in a negative sense. Modal verb being to ascertain and certainly. That says it's the opinion of both. Might speaks about opinion, more speaks about comparison and a scale. Okay, just to give you an idea, the structure again, point, problem, reasons discussed, and 1, 2, 3 reasons were there. We selected the second reason. So now dialogue structure is this. This is what you have to understand as regards to the dialogues. I think today's we have 5 dialogues and 1 monologue. Well, first one is point. OET Zoom session is the point or the subject or the focus or the concept. Okay, and problem is poor registration, poor attendance. Okay, reasons discussed. What are the reasons discussed? First reason, no notice given, not properly publicized. Second reason, many sessions available. Third reason, not aware of the importance. So this is a structure of all the dialogues. Maybe they have different concepts, different topics, but this is the structure. It can be reasons or there can be solutions, anything. But then this is the structure. This should be in your mind. So as soon as you get into those 15 seconds, golden seconds, you have to assess for these things. What is the main problem or the concept being discussed or explained? Then how it is solved, or what are the reasons given, or what are the solutions provided? Those things. Hope it is clear for you. Okay, para dialogue structure. The dialogue structure is this: point, topic, sentence. So the main idea is being presented in the question as well as in the answer. Main idea or the gist. Second one, as I said, explanation will be there. Supporting sentence. That will be the explaining the main idea. What is the topic, concept, main concept that will be being explained. Third step is evidence. They might give some example or illustration of the main idea. Then fourth one, link, which means conclusion. Maybe they speak something and they put a contrast or they give a contrast expression and say something else. So that becomes the answer, conclusion. Okay, now we will get into the real question. Now just read this. Just read this, please.
You hear a dentist discussing booking problems with the hair receptionist. What has caused the problem? Option A, an error with the booking system. Option B, a double booked appointment. Option C, a lack of communication.
So just try to find out the stem words. As I said, here who is speaking? Dentist. He is discussing. There is somebody else, okay? There is a dialogue, right? Booking problems. What is the concept or issue? Booking problems. Who is he speaking with or discussing with? Receptionist. These are the main things you have to analyze in the few seconds that you have, for 15 seconds. What has caused the problem? Means they are asking for a cause. What is there is a problem? What is the problem? Booking problems or registration problems. As I said, we have poor attendance or registration for OET Zoom session. Here, what has caused the problem? That's the question. So you have to find out a cause. First cause, an error with the booking system. Second cause, a double booked appointment. Third cause, a lack of communication. Do you see that structure so clearly given? So when you listen to the audio, listen in this context to identify one of these three should be the answer. So which is the answer?
You hear a dentist discussing booking problems with her receptionist.
This is a 15 seconds to read the question and the answer options.
Hey Kieran, Mr. Lau just mentioned that he'd tried to reschedule his appointment yesterday, first online, and then when that didn't work, he called up. But apparently he couldn't reschedule. Any idea why?
I wasn't working yesterday, but let me check the notes. So Lana left a note about the call. She says that Mr. Lau wanted to reschedule, but we didn't have any other appointments this week after 3 p.m., which is the only time he could make. He asked if he could make an appointment next week, but his procedure was marked on our system as urgent, so she had to make it in the same week. The system wouldn't have let her reschedule it any later. She wouldn't have had the authorization to change that. Still, she should have discussed this with you at lunch or at the end of the day, because then you could have decided whether it could have been postponed for a week.
Yeah. In his circumstance, it would have been fine to reschedule at a slightly later date. We should prevent something like this from happening again.
You're right. I'll talk to her about it tomorrow, and I'll send out an email to everyone else so that they're aware.
Okay. Did you get the idea?
Yeah.
What is the answer?
Lack of communication.
Lack
of communication.
Okay. Okay. Let's assess how it is. So, dentist discussing booking problems to receptionist. Three things you have to notice immediately as you go through the question and the answer options in the 15 seconds. What has caused the problem? They are asking for a reason. Okay. There is a problem and 3 reasons explained, which is the one. Okay. So the topic is reschedule his appointment. You know, the audio begins with you hear a dentist discussing booking problems with a receptionist, which is already here in the question statement. So you have read it. So immediately you can, they will say again, they will repeat it here in the audio. Okay, what you had in the question statement. Now you say reschedule his appointment. Okay, so reschedule is the issue. That is the key word being repeated again and again. You see here, reschedule, couldn't reschedule, again reschedule, reschedule, reschedule. That's what I said. The key word will be repeated again and again. Reschedule his appointment. It was not done. Couldn't be rescheduled. Why? Reason has to be said. So they are saying he asked if he could make an appointment next week, but his procedure was marked on our system as urgent. So she had to make it in the same week. The system wouldn't have let her reschedule it any later, means than the next week. She wouldn't have had the authorization to change that. Still, she should have discussed. Still, she should have discussed. The still is the key word here. So all these things are saying, as per the rule, there was no possibility of rescheduling. But then it still says, in spite of all that, she should have discussed this with you at lunch or at the end of the day, because then you could have decided whether it could have been postponed for a week. Now you see, yeah, that is being emphasized, saying next response, yeah. In this circumstance, it would have been fine to reschedule at a slightly later date. So rescheduling was possible. But why? An error with the booking system, they don't say anything about the booking system at all. There is no error with the booking system. And double booked appointment, nothing to speak about. They are not speaking anything. A lack of communication. She should have discussed. She should have communicated. Then we should have found out a solution. That's why I said the gist is the reason. They don't clearly speak about lack of communication. But you should have told me, then I would have found a solution. If I tell you that, it shows that you did not communicate it to me. Otherwise, I would have found a solution. For example, today many were not able to attend because there was rain and lightning. If you would have communicated me, I would have postponed today's session to tomorrow. So the problem is you did not communicate to me, not the rain or the other things. Okay. Hope that is clear to you. Okay. Yes. Question 26. Please read.
You hear a doctor discussing chest X-ray information with a medical student. What is the doctor explaining? Option A, the order for discussing results to the patient. Option B, the information to include in patient notes. Option C, how to correctly examine the patient's condition.
Okay. Now you see a doctor discussing chest X-ray information with a medical student. Doctor is there. A chest X-ray information is the issue here, or the concept here, or the focus of the conversation, and with a medical student. What is the doctor explaining? Now you have to understand the gist. What is he explaining about? The order for discussing result to the patient. Does the audio speak anything about about discussing the results of the X-ray to the patient? That's what you have to understand in the 15 seconds. Now, we fast read. Then the second one, the information to include in patient notes. Does it speak about does he explain about how to write the patient notes? And third one, how to correctly examine the patient's condition. Does it speak about any examination of patient's condition? So these are the three options.
You hear a doctor discussing chest X-ray information with a medical student.
Hey, Dr. Yan, we've got the x-rays back from Mr. Regis in bed 8 from this morning.
Great. Can you document them in the notes?
Do you mind showing me how to write the interpretation properly?
Of course. Make sure you put the patient details. Full name, date of birth, patient number, and home address first. Then put the hospital and ward, date, and time. Make sure your name is on the document too. Include the indication for the x-ray like hemoptysis or dyspnea before documenting your interpretation. Now, I use a simple mnemonic to make sure I don't miss anything. A, B, C, D, E. Airway, trachea, carina, bronchi, and the hilar structures. Breathing, lung fields and pleura. Cardiac, heart size and heart borders. Diaphragm, position, shape, and costophrenic angles. Finally, everything else, the mediastinal contours, bones and tubes or devices. Make sure you document everything clearly using this system in the notes.
Okay. Any idea?
Option B.
Option
B.
B.
Option
Yeah.
B.
Did you
Information to include.
yeah, did you notice how they repeated the patient notes in different ways?
Yes. Yes.
Continuously they were repeating, right? See
Yes.
here. See can you document them in the notes? Document means patient notes. Document them in the notes. Question itself says, what is the answer? Can you document them in the notes? Then do you mind showing me how to write the interpretation, which also means notes? Put the patient details, again indicates patient notes. The document again speaks of patient notes. Then documenting your interpretation again speaks of the patient notes. And finally, everything else, document everything clearly. Again, it speaks of patient notes. So the synonym or the synonymous of the patient notes is being repeated again and again, whereas you have nothing to do with the patient. There is no word patient is never mentioned, patient condition is never mentioned, right? The first option and third option, there is the discussing results of the patient, examine the patient's condition. That's not given at all. Nothing is mentioned about it. So here, from the very first question, you have to listen to this question as well. Then you have the thing being repeated again and again. Same thing. So keywords are very important. Just listen to the keyword or the synonym being repeated again. So immediately you can confirm what is the answer. Yeah, hope that is clear for you. We'll go a little faster because there are no beginners, I believe. Yes, please read. By the end of reading, Lily Mole will play, okay?
You hear an ENT surgeon talking to a colleague about cochlear implants. The surgeon is explaining that cochlear implants, option A, transmit voices more clearly than other noises. Option B, emit a variety of sounds into a microphone. Option C, restore hearing in deaf people.
You hear an ENT surgeon talking to a colleague about cochlear implants.
We implant an electrode array which looks like several small wires made of a platinum iridium alloy into different regions of the cochlea. These metal wires conduct the electrical impulses generated from the microphone, which picks up sound from the environment and sends the signals to the electrode array through a transmitter. There's also a speech processor between the two that filters more important sounds so that the patient can hear people talking rather than other sounds.
Right, okay. So does this restore hearing to normal levels?
No. With the current technology, we're giving deaf people a good representation of sounds from the environment and help to understand speech. After surgery, patients undergo therapy to relearn the sense of hearing. Not everyone benefits from the device to the same extent.
Right.
Sorry. Any idea?
A father transmit voices more clearly than
Okay, let's check why it is. Okay, you said transmit voices more clearly than other noises. Okay, let me check. Yeah, how does it work? Yeah, see here, descriptive paragraph, topic cochlear implants. What is it? How does it work? What is it? What is its function? Okay, so this is called descriptive paragraphs. I believe I have explained to you about 6 types of paragraphs, right? Maybe many of you have attended it. So if you would, to know the nature of the paragraph, it helps you to understand where the answer is easily. So this is a sort of descriptive paragraph. Topic is cochlear implants, and first part says of the paragraph begins saying what is cochlear implant. Then it says how does it work. Then what is its function. So you see, generated from the microphones. Here you see, emit a variety of sounds into a microphone. Generated from microphone is quite opposite to into a microphone. They are just opposites. So that is wrong. And filters more important sounds so that the patient can hear people talking rather than other sounds. You see, voices, noises, sounds, the synonym sounds is being repeated several times in this paragraph. And again, you have the question right. Okay, so does this restore hearing to normal levels? So restore hearing in deaf people? No, categorical no. So immediately, it doesn't restore. With the current technology, we are giving deaf people a good representation of sounds from the environment. That is similar to paraphrasing of more clearly, voices more clearly, transmit more voices more clearly. Means we are giving deaf people a good representation of sounds from the environment. So this is the paraphrasing. So this answer is being again re-emphasized in the second sentence. First they say filters more important sounds so that the patient can hear people talking rather than other sounds. As I said yesterday, that is a clear paraphrasing of transmit voices more clearly than other noises. So exactly the paraphrasing is given here. And when they asked, does this restore hearing to normal levels? They says no. With the current technology, we are giving deaf people a good representation of sounds from the environment. So this is like repeating the same thing, emphasizing it, saying no, it doesn't restore, but it does this. Is that clear?
Yes.
Yes. Yeah, please read. And soon after that, Lilimol will play the audio. We'll go faster. Yes.
You hear a GP talk about diagnosing type 2 diabetes mellitus. Why should a fasting plasma glucose test be booked in the morning? Option A, the patient will need to attend an 8-hour appointment. Option B, the test will need to be carried out twice. Option C, to allow the patient to eat during the day.
Okay, now Lilimol, 1 minute. Can you predict this answer? You know what is glucose, fasting plasma glucose test, right? Without the audio, can you predict the answer? If you have heard it earlier, it's okay. Otherwise, is it possible for a health professional to predict? Why should a fasting plasma glucose test be booked in the morning? Does it require the patient will need to attend an 8-hour appointment? Do they need to be in the hospital for 8 hours? 8 long hours?
No.
Yeah, the test will need to be carried out twice. The test will need to be carried out twice. Do you need to carry out the fasting plasma glucose test twice?
No.
No. So ultimately, to allow the patient to eat during the day, because 8 hours of fasting is required. So take it in the morning so that during the day they can eat, because you have fasting 8 hours in the night. And actually, you don't require any knowledge, any audio to answer such type of questions that we call predicting the answers. And once you go through these options and to allow the patient to eat during the day, if that is the answer, if these two are not the answers, this should be the answer, right? The patient will need to attend an 8-hour appointment. We don't have 8-hour appointment in the hospital for fasting plasma glucose test. The test will need to be carried out twice. Normally, we don't require, only they say to confirm it second time it has to be done, but then normally it is not the condition. So when these two things are not the correct one, the other one must be the one. Let's listen and confirm it.
You hear a GP talk about type 2 diabetes mellitus.
Hello, I'll be covering the diagnosis of type 2 diabetes mellitus. So there are 4 methods that we can use. The first is a fasting plasma glucose test. This is our preferred diagnostic test, as it's easier to carry out, often more convenient, and costs us less than the other 3 tests. It helps to try and book these appointments in the morning, as the patient has to refrain from eating for at least 8 hours before they can take the test. Normal fasting blood glucose will be between 70 and 100 milligrams per deciliter. A value of over 126 milligrams per deciliter indicates a diagnosis of diabetes. Bear in mind that this test should be carried out twice to confirm a positive result. The second method we can use is to measure the average glycemic load over the past 3 months.
Okay. See? So type 2 diabetes fasting plasma glucose. It helps to try and book these appointments in the morning, as the patient has to refrain from eating for at least 8 hours before they can take the test. So it's very, your prediction is exactly right. And this test should be carried out twice to confirm a positive result. It doesn't say the same day, same appointment, you have to do the 2 tests. It can be later as well, right? After another day, you have to fast and you can't take the second test that day itself. That doesn't mean, normally we don't do it. We'll visit second time. If you have to be confirmed, we'll take another fasting plasma glucose test. That is clear, no? So prediction can work a lot. That's why I said the 15 seconds are known as the golden seconds. Try to predict, then while listening, you will understand it better. Okay, please read.
You hear a dentist talking to a patient with a chipped tooth. What does the patient want to know? Option A, how long the procedure will last? Option B, when her next appointment will be? Option C, what her different treatment options are?
Okay, just listen to the audio. So how long the procedure will last, when her next appointment will be, what her different treatment options are. What dentist, patient, talking, chip tooth. Patient want to know something. Just what is the patient concerned with?
You hear a dentist talking to a patient with a chipped tooth.
So we've talked about different options, and it seems like a veneer would be the best treatment. Given the cost of the procedure, are you happy to go ahead?
It's quite expensive, but I definitely need to get it fixed. Will it stay put?
Veneers tend to need replacing every 10 to 15 years, so they are a long-term solution. It will certainly be more durable than composite bonding, and it will look more realistic too.
Oh, okay. That's great. And is there anything I can do to extend their lifespan?
Well, you need to maintain good oral health. You know, brushing, flossing, regular checkups. You should avoid brushing your veneer too hard, as it could cause damage.
Okay.
Do they speak anything about the procedure?
No.
About next appointment? Nothing. Nothing about appointment at all. What are different treatment options are? Where as soon as they start, they are saying the best option, which means see different options. What are different treatment options are? See, in the very beginning, you hear a dentist talking to a patient with a chip tooth. So we have talked about different options. I said no topic sentence gives the key concept or the keyword. So different options, the clue is there. And it seems like a veneer would be the best treatment. So when they're speaking about the best, the scale is being used there, best treatment, that also says that is the answer. Okay. Given the cost of the procedure, are you happy to go ahead? It's quite expensive. It looks like when you listen to it, looks like it's very expensive. I don't want it. But they're saying it's quite expensive, but I definitely need to get it fixed. Though it is expensive, I want to go through it or opt for it. Will it stay put? Veneers tend to need replacing every 10 to 15 years, so they are a long-term solution. It will certainly be more durable and look more realistic. Everything speaks about more. All the comparison and scale says that is the answer. Okay, and that's great. Means I agree with that. And is there anything I can do to extend their lifespan? So they're speaking about the treatment options, nothing else. Because how long the procedure? Nothing. They speak about the procedure. When her next appointment will be, that's also not being spoken of. Appointment is not spoken of at all, right?
Yes, Father.
Yeah, please read.
You hear a podiatrist talking to a patient with fallen arches. The patient explains that his treatment, option A, will need to continue for some time. Option B, has become too time-consuming. Option C, is not improving his condition.
Okay. Patient explains that his treatment will need to continue for some time. Yeah, please, audio.
You hear a podiatrist talking to a patient with fallen arches.
So, you say you're experiencing foot pain. Are you wearing supportive shoes?
I'm wearing appropriate shoes, and I'm also wearing orthotics that should be helping, but I'm still experiencing pain in my feet. Sometimes they feel a bit numb too.
Right, okay. And you mentioned that you've been given some foot exercises to do?
Yeah, the physiotherapist I went to showed me those. At first I thought they were helping, but now I think I'm as bad as I've ever been. Is there anything else we can do?
See, the contrasting words clearly give the answer. You see, I am doing something, treatment. What is the treatment? Wearing appropriate shoes. I'm also wearing orthotics that should be helping, but I'm still experiencing pain in my feet and also a bit numb. See, but it is not improving, but it is not helping. Again, they say, yeah, the physiotherapist I went to showed me those, and at first I thought they were helping, but now I think I am as bad as I have never been. I'm as bad as I have never been, means my condition is very bad, which means I'm not improving. So they don't speak anything about we'll need to continue the treatment more or has become too time consuming. He doesn't speak anything about I'm wasting my time or taking too much time, nothing of that sort. So whole gist you have to understand, saying that in spite of all this experience, each treatment he is highlighting and saying, but contrasting expression, then he says, I'm still experiencing pain. It has no improvement. There is no improvement because of this particular procedure. Or the next one, physiotherapist taught me all these things. I'm doing all those things. But now I think after doing all these procedures, I am as bad as I have never, ever been. I am not now better, but I am worse. Is that clear? So this is what known as gist. And clearly they explain it, emphatically explain it. To listening part. Today we'll be looking into the second extract from the listening C task that we have posted in the platform, and we'll be taking a different approach. Occupational English test, listening, part C, extract, track 2. And listening key skills. Yes, skim the audio. You know how to skim the audio. Like as you listen to, you have to look into all these things which are very familiar to you, synonyms, language, paraphrasing, scale, modal verbs, to understand the opinion and factual statements, time expressions or chronological expressions, name of something or some person or place, comparison, contrast, number, age, year, all those things, stem words, maybe reason and cause. Stem words should be understood so that you understand what is the effect or what is the reason. Keywords or phrase, reference, negative meaning, and conclusion. So as the audio begins, introduction, listen the audio carefully from the very beginning itself. I'll tell you why it is important. The very first few sentences are very, very important. That's the thing that guides you or enlightens you as regards the audio, remaining part of the audio. So the beginning part contains the introduction with the topic and its descriptions. It will give you a summary of the whole audio. So you know what are the things being explained in the coming portions. And unless you understand the introduction part of it, you will not be able to understand the whole audio. Listen for the gist of the audio. Here you are not listening to each word or those things, but try to understand in the context, for which, as I told you, the beginning is very important. Okay, as you go in the beginning, introduction is very important. Listen carefully to try to understand. Don't try to understand anything else. We have not looked into even the questions. So what you have to understand, what is the topic, what is the sequence, what are the issue they are explaining, the problem they are explaining, what are the reasons for the problem or causes for the problem, then what are the effects and what are the solutions they are trying to put in. Okay, just listen to those things. We are taking a different method today.
Look at extract 2, questions 7 to 12. You hear a physician called Dr. Hubert Johnson discuss improving efficiency at a healthcare practice. You now have 90 seconds to read questions 37 to 42.
Hi everyone, my name's Dr. Hubert Johnson, and I've been asked to speak to you about my experiences in the healthcare industry concerning something that affects all health professionals, improving efficiency. It seems to be a given these days that practices will struggle with a lack of efficiency. We've actually found that this expectation in and of itself can reduce efficiency and increase delays even further. In a recent survey, when patients were asked why they arrived late to their appointments, 30% said that they had assumed that the previous appointment would run long. Patients expect to be kept waiting, and to some extent, we expect that patients will be kept waiting. And so the first thing we need to address is our attitudes and the attitudes of our patients. So let me start by telling you about the efficiency I observed in a practice I visited a couple of weeks ago. At this practice, patients could not make appointments online, but they could either phone up or make an appointment in person. There were never more than 2 receptionists working in the morning, and the practice generally scheduled 80 appointments each day. Patients who were not attending a follow-up appointment were required to make their appointment on the day off. Can you imagine what that practice was like in the first couple of hours they were open? The receptionists were inundated by calls and walk-ins trying to schedule appointments. As you can imagine, patients who had seen what the practice was like in the morning expected that if they didn't have the first slot of the day, they'd be delayed by at least 10 minutes. So naturally, they arrived to their appointment 10 minutes late. One of the most important things you really must address in your practice in order to improve efficiency is the way you present your practice to patients. If they believe that you are always running late, guess what? They'll be running late too. Now, let's think for a moment about what needs to be done on the patient's end before an appointment can take place. You might be thinking that there are only 2 steps to the process. 1, the patient books an appointment, and 2, the patient arrives at the practice in time for their appointment. Well, we healthcare professionals often forget that there's actually a step that comes before this. Firstly, the patient must decide that their issue is significant enough to warrant an appointment. So, about a decade ago, my practice was really struggling from a lack of efficiency. I was working extremely long hours to try to accommodate everyone, and I was becoming increasingly frustrated with conducting appointments that didn't seem strictly necessary. I got to thinking about how I might be able to help patients to reconsider their initial assumption when booking appointments and to treat minor issues at home. At the same time, I did not want my patients to feel unsupported. I decided that I would begin to give weekly presentations in the evenings about self-care. As I tended to see a multitude of patients coming in for similar issues that they could actually treat themselves, each week I focused on a different common theme. The presentations lasted for just 1 hour, but I found that they resulted in 7 fewer unnecessary appointments each week. These days, of course, I no longer have to give a physical presentation. Thanks to modern technology, I simply upload instructional videos to our practice's website. We also email these videos out to patients periodically. We can and should make use of technology as a tool in our practices to help us improve efficiency. However, it's important to note that while many, perhaps even the majority of your patients will be capable of using technology to arrange their appointments, there are many people uncomfortable or unable to use technology, so you must always make sure that these patients are accommodated too. Providing your patients with more options rather than replacing old options is often the best practice for improving efficiency. Now, let's move on to look at a practice that used technology in a surprising way.
So we'll just see the script. Okay. So what is the introduction? Who can read it for me? Maybe see the topic. What is the topic? You just read the introduction. Someone can unmute and read.
You hear an presentation given by Dr. Hubbard Johnson, who is talking about ways to improve efficiency.
Yeah. So what is the topic?
Improving efficiency.
Ways to improve efficiency. Yeah. So that is the main topic. You have to really understand that. Okay. The very first sentence will give you the topic. Again, it will be repeated. Okay. Continue reading.
Hi, everyone. My name is Dr. Hubbard Johnson, and I have been asked to speak to you about my experiences in the healthcare industry concerning something that affects all health professionals, improving efficiency.
So what is the topic? Improving efficiency in healthcare industry. Okay, improving efficiency is the topic. Improving efficiency in the healthcare industry, and you immediately you have to predict. That's one of the best golden strategies that you have to use. How to improve efficiency? In what area you have to improve the efficiency? Healthcare industry is so vast. So you have to listen to the area, specific area in healthcare, under healthcare industry, what is being focused in this audio. Yes, continue. It seems.
It seems to be a given these days that practices will struggle with a lack of efficiency. We have actually found that this expectation in and of itself can reduce efficiency and increase delays even further. In a recent survey, when patients were asked why they arrived late to their appointments, 30% said that they had assumed that the previous appointment would run long. Patients expect to be kept waiting, and to some extent, we expect that patients will be kept waiting. And so the first thing we need to address is our attitudes and the attitudes of our patients.
Okay.
So
what is the focus here? Under the healthcare industry, what particular aspect of the healthcare industry is being addressed in this audio? As per the introduction.
We have to keep appointment.
Appointments. Yeah. Appointments. You can see the words, no, the vocabulary of the family. See, lack of delays, appointment, their appointment, previous appointment, waiting. Okay, these are the things showing that appointment is the particular area or the controlling idea of this audio. The topic is improving efficiency on the healthcare industry, whereas the controlling idea of this audio, the whole audio, is appointments. Efficiency in the process of appointments, giving appointments or process of appointments. And the solutions are given, 2 solutions in the introduction. What are the 2 solutions?
Should change your attitudes.
Address our attitude means health professionals' attitude. Second one, attitude of patients.
Attitude of patients.
Yeah, only these things will be discussed in the coming portion of the audio. That's how you have to focus yourself. Once you listen clearly to the introduction paragraph, things will be very clear to you. So the topic is improving efficiency. Specifically, those who have enough time, make sure that you write down this way the topic, then the description. How do they describe the topic? Lack of efficiency in appointment process resulting in delays. Okay, solution. What are the solutions? Address practice, health professionals' attitude, address attitude of patients. So write down this aspect or this model, and in your notebook, just take the introduction and find out what is the topic, how the topic is being described, and what was the issue, and what are the solutions being given in the introduction. So, these are the solutions. Address practice, address your attitude. Health professionals should address their attitude first. Second, attitude of patients. And these 2 attitudes, attitude of health professionals and of the patients, will be explained or detailed in the coming portions of the audio. Okay, introduction. Once again, I am giving you, this is how you have to write down. I don't say you should make the PPT, but at least write down. As soon as you listen to the audio, don't go to the script, listen to the audio. That's why I said 7 steps. When you analyze the audio, listen to the audio and try to find out from the first paragraph what is the topic. The very first line will give it. Again, introduction will repeat it. Improving efficiency, description, cause lack of efficiency in appointment process. Effect is delays, means inefficiency. Cause is lack of efficiency in appointment process. Effect is delay happening. Okay, solution, mend your attitude, mend patient's attitude. These are the solutions. Okay, now just see this text, not for reading, just see and tell me what is it. What do you see here highlighted? Could somebody read whatever is highlighted in this color, one particular color, not yellow and green, but other colors, other than yellow and green, this color. Just read somebody, and others count, okay, how many times it is given. Okay.
Previous appointment.
Yes.
Make an appointment.
Yes.
Appointments. Follow-up appointments. Their appointment. Schedule appointments. Slot of the day. Their appointment. An appointment. The process. An appointment. Their appointment. A lack of efficiency. accommodate everyone, appointments, booking appointments, patients coming in, appointments, their appointments, accommodated, options, options.
Did somebody count how many times appointment has or synonym has appeared?
23.
23 times in such a small audio. This will happen same thing in your reading as well. Okay. Reading part C, you will have this. So the main idea is improving efficiency in healthcare sector. The controlling idea, we call it. What is the specific area focused in this audio is appointment. So it is repeated 23 times. I don't think there are 23 sentences here. More than the number of sentences, the same concept, controlling idea is repeated. You should focus yourself into that, and all the answers will be linked to those things. Now, can somebody tell me, beginners may not be able to say, what are these green things?
Scales.
What are they?
Scale.
Hmm?
Scale and
Yeah.
modal verbs.
Yes. Then
Adjectives.
adjectives, adjectives, numbers. Yeah. Okay. Yeah. That's why I said this is not beginner session. So you understand what I have highlighted. Okay. You have to highlight this way. As you practice, you have to, that's what I said, you have to underline when you listen to the audio, you have to underline holding the script. You have to, under those 7 steps, it happens, you have to, that's what I said, you have to underline and circle and highlight the strategies. Okay. Main things, main aspects and strategies. Yes. Now you see the sequence of the audio. We'll just look into it. Okay. Audio sequence. Introduction, topic, improving efficiency. Para 2 speaks about patient's expectation. Para 3 speaks offline appointments only. Para 4 speaks mend your attitude, must. Para 5 speaks mend patient's attitude, must. Para 6 speaks results of weekly presentations. Para 7 speaks of having both online and offline appointments to solve the issue, to make it more effective. Do you see a connection there? See, improving efficiency, patient's expectation. What do the patients expect? What is their attitude? Offline, actually, in the beginning, there was only offline appointments only. So what happens? Everybody will rush in. And 2 receptionists, more than 80 appointments every day, calls and walk-ins. So they were struggling like anything. So mend your attitude. First, health professional's attitude should be corrected. Then patient's attitude must be corrected. Result of weekly presentations as a solution to this, because everybody is coming with all minute complaints, which can be self-treated. So the doctor started to give weekly presentations, sessions or awareness programs, whereby the number reduced. Online and offline appointments were given. So we can't, it takes long time for you to read each paragraph or listen to each paragraph and go. So you just have an idea here. See, this is the paragraph here. Here you see para 1, introduction is there. Then you have para 2, patient's expectation. They had assumed that the previous appointment would run long. Patients expect to be kept waiting. That assumed means they're expected. They think the previous appointment will go long, so why should we go and wait there? So we'll go a little later. That's a common thing, no? So para 3 speaks about offline appointments only. You see, I observed in a practice I visited a couple of weeks ago. In this practice, patients could not make appointments online, which means negative meaning. Patients could not make appointments online, which means negative meaning, which means only offline appointment was possible. Okay, the strategy is there, but they could either phone up or make an appointment in person. Again, that is being explained, saying that only offline appointments. So why the inefficiency? Telling you about the efficiency. I observed a practice I visited a couple of weeks ago, illustrating, saying what is the effect of having only offline appointments. Then next paragraph, para 4, mend your attitude. As you can imagine, patients who had seen what the practice was like in the morning expected that if they didn't have the first slot of the day, they would be delayed by at least 10 minutes. They will be, so their attitude is, we have to go late. We can go late because we will be made to wait there. Okay. So what you have to do? You have to mend your ways. I'll explain that later. And mend patient's attitude. What needs to be done on the patient's end? The very beginning of the audio or the script says what needs to be done from patient's side. And I'll highlight those strategies later. And weekly presentations. This paragraph 6. Then paragraph 7 says you should have online as well as offline appointments. Okay. Question sequence here. See, this is in sequence. Can somebody read one by one?
Johnson explains that delays are increased when patients believe.
Okay, this is these things are added. They are not in the question paper. Now, Dr. Johnson explains that delays are increased when patients believe. First one speaks will not begin on time. Appointment will not begin on time. Staff are not concerned about late arrivals. Being late, appointments will not impact others.
The appointments will not begin on time. Is the
Okay.
answer.
Okay. Staff are not concerned about late arrivals. Normally, do you think that will happen?
No.
For example, doctor is waiting and there is nobody, and doctor is simply waiting there. Staff will be definitely concerned, right? From
Yes.
general knowledge, you know, that is a wrong statement. Staff are not concerned about late arrivals. Anywhere, late arrivals are not appreciated. So in itself, without even listening to the audio, your general knowledge will tell you that is a wrong answer. Being late for appointments will not impact others. Does it impact others? You are coming late, the next person will have to wait, right? So it will definitely impact
Yes.
others. That's what I'm telling in your, it's not unlike IELTS. IELTS, you will have 2 or 3 correct answers, almost right answers. You have to find exactly the correct answer. But here, most of the time, both the answers are not relevant at all. Only one answer is relevant. So there is no confusion between the answers. So you can just skim the question paper, just go through the question paper during the time given, then confirm from the audio. Here you know exactly the first one should be the answer because that is clearly stated there. Even otherwise, B and C is irrelevant from the general knowledge. Okay, 38, somebody read, please.
Dr. Johnson uses an example for poor efficiency to illustrate the point that A. Healthcare professionals should assist staff during busy times. B. Practices should avoid limiting appointment booking option. C. Staff should be trained to handle demanding situations.
Okay. Now the 3 things given here is, one is the staff nurses should go and assist the receptionist. Assist the staff means 2 receptionists are there. Normally, do they do that? Will they be doing? Maybe in India, but never other countries. Okay. Nurses will never be assisting receptionists. That will never happen. So first one is definitely by general knowledge, it's a wrong answer. Third one is staff to be trained. Does the audio speak about training the staff? That you will have to identify from the, yeah. So healthcare assisting staff, and the third one is training staff. That's what I said. You have to skim the questions, stems, and answer options. Practice should avoid limiting appointment booking options. So do you see the controlling idea is in which thing you have controlling idea? Appointment booking options, right? That's the main controlling idea of the all audio I said from the introduction. So there is a clue for you. Okay, third one.
Dr. Johnson explained that in order to improve efficiency, healthcare patients must. Option A, sanction patients arriving later than 10 minutes. Option B, avoid booking appointments in the morning. Option C, show patients that they can run on time.
Yeah, now sanction patients means punish patients. Okay, those who come after more than 10 minutes later will see the doctor only in the afternoon, or beat them up 10 times. Okay, or make them kneel down. Some punishment. Is it possible? Normally?
No.
Normally you don't do, right? Because they will come little late, but they will enter the slot and they will be delayed when they come out. And avoid booking appointments in the morning. No appointments in the morning at all. Till noon, everybody is sitting there. No patients are taken. Will it happen? Can it improve efficiency?
No.
No, it cannot improve efficiency. In the afternoon, you will have to take all the 80, right? So it will cause more inefficiency. So you see, in general sense, the options are eliminated. General sense, avoid booking appointments in the morning to create efficiency. Means till noon, there is no appointments, no patients. Doctor and the staff, nurses are sitting there with the staff. That's so meaningless. So show patients that they can run on time. Show patients that they can healthcare practices must. Okay, show that we'll be punctual. I have to show that I will be punctual for the sessions, right? Then OET aspirants will be punctual. So what is the possibility? These two are not relevant at all. So definitely third should be the possibility. Let's see. Okay, number 40.
Dr. Johnson says, healthcare professionals often forget that patient who book appointment must first. Option A, consultation. Option B, find a time and date that. Option C, consider what might be causing their issues.
Yes. Now you see a previous one, and here I have highlighted the modal verb and that this one first, that time expression. Okay, first, second, third. So the chronological expression also I have highlighted. That will be there in the text as well as a clue for you. So Dr. Johnson says healthcare professionals often forget that patients who book appointments must first. What should they feel, or what should happen from their side? Feel that they need a consultation, find a time and date that works for them. Now you see, now who is supposed to do here? Patients who took appointments must first find a time and date that works for them. It's not health professionals. So there is consider what might be causing their issue. Who? Patients cannot consider their issue, right? Now, who is working on efficiency now? Health professionals. But here, what is the patient supposed to do? That is the question here. So you'll have to find out the answer. Yes, 41.
What happened when Dr. Johnson began giving weekly presentations to patients?
Yeah, what happened means the result of weekly presentation. What was the result of weekly presentation? That's what you have to search in the audio, listen to in the audio. Yes.
Option A, Dr. Johnson was able to work fewer hours. Option B, the general health of patients was increased. And option C, the number of appointments at the practice decreased.
What was the result of weekly presentation? Means weekly classes or awareness programs given. One was Dr. Johnson was able to work fewer hours. Second, the general health of patients was increased. With awareness program, can the general health increase? The number of appointments at the practice decreased. Okay, we'll see for the answer. Okay, 42.
How does Dr. Johnson feel about the use of technology when booking appointments? Option A, practice should begin to encourage all patients to make bookings online. Option B, it can increase efficiency if other booking methods are continued. Option C, elderly people are most likely to struggle to use it.
Okay, so what does Dr. Johnson feel about the use of technology when booking appointments? Practices should begin to encourage all patients to make booking online. Should all book online, no offline bookings? First one says no offline bookings, only online bookings. Second, B says it can increase efficiency if other booking methods are continued. Means you have to carry on both offline and online booking. Third one, elderly people are most likely to struggle to use the technology. Does the audio speak something about elderly people? That's it, what you have to identify. Yeah. So we'll see. So the questions, see the question sequence. How does the question go? First one, 27 speaks about patient's belief. 28, example to illustrate poor efficiency. 39, a must change in practice to improve efficiency. 40, a must change in patient's attitude. Okay, this is professional attitude. Here, patient's attitude to improve efficiency. 41, result of weekly presentation. 42, Dr. Johnson's recommendation to improve efficiency. You have to have appointment process offline as well as online. Okay, see, this is the patient's belief. Here you see the clue is when patients believe their opinion. Okay. And example to illustrate poor efficiency. Dr. Johnson uses example of poor efficiency to illustrate the point that a must change in practice means change in health professionals. A must change, each question speaks of these concepts. So you have to identify when you scan the questions, you have to identify the concept of the question or focus of the question, what they are asking for. So then you will be able to listen to the same thing. Now audio sequence and question sequence. See, these are the question sequence and the corresponding audio sequence is this. Patient's belief, opinion is the question, patient's expectation in the audio. Example to illustrate poor efficiency, offline appointments only will result in poor efficiency. Para 4 speaks a must change in practice, men practice attitude, must. Men practice attitude again, must change in patient's attitude. Practice attitude and patient's attitude. Practice means health professionals. Result of weekly presentations, result of weekly presentations, online and offline appointments, Dr. Johnson's recommendation. This is how you have to write down these things. Can you see my screen?
Yes, Father. Yes, Father.
Yeah. Dr. Johnson explains that delays are increased when patients believe. Believe what? We said staff are not concerned about later arrivals and being late for appointments will not impact others are false statements. They are not at all real statements. So automatically, answer is their appointment will not begin on time. See, the research example says 30%. Already one number is there, said that they had assumed that the previous appointment would run long. What is would? Model, right? Run long. Patients expect to be kept waiting, and to some extent, there is a scale expression. We expect that patients will be kept waiting. And so the first thing we need to address is our attitudes and the attitudes of our patients. So when patients were asked why they arrived late to their appointments, 30% said that they had assumed means they believed or they took it for granted. Is that clear? These
Yes,
are simple.
yes, Father.
Yeah. An example is used here to illustrate what? Assist staff, I said, is a false statement. Normally, the nurses will not be assisting the receptionist for appointment or things. Practitioners should avoid limiting appointments. Staff should be trained to handle demanding situations. There is nothing about training in this audio at all. So I observed in a practice I visited a couple of weeks ago, patients could not make appointments online. Means what? Only offline appointments. That is being explained again, but there is a contrast word, but. They could either phone up or make an appointment in person, means offline appointment. So this paragraph speaks about, the topic sentence is about only offline appointments, no online appointments. See that this is what the topic sentence here, initial sentence, then you see that's being explained again at the end. What do you if there is only online or offline appointments, what will happen? Can you imagine what that practice was like in the first couple of hours they were open? The receptionists were inundated by calls and walk-ins trying to schedule appointments. They were terribly struggling because they have to attend the call. Only 2 receptionists are there. They have to attend the calls and attend the walk-ins, patients, give them bookings or appointments. So it's clearly given. The same thing is explained in the whole paragraph. The whole paragraph focuses only offline appointments is an example for lack of efficiency. So what should be the answer?
B.
Practitioners should avoid limiting appointments, booking options, means should not limit to only offline. You have to go online and offline. So should not limit. See, so the nothing about training. And as I said, first one is a false statement because you don't, nurses don't go and assist in the reception. Okay, question 39. See, doctor explains that in order to improve efficiency, healthcare practices must. What should be the correction from the part of healthcare professionals? Now, so naturally they arrived to their appointment 10 minutes late. One of the most important, the scale is there, right? The most important one number is there, most scale is there. Important things you really must. Question says healthcare practices must. You really must address in your practice is the way you present your practice to patients. Means you should show that you are punctual. The health professional should show that if you are given an appointment, you will be punctual, you will not be made to wait. So clearly it is given there. Must and must is the clue here. Healthcare practices must. One of the most important things you really must, you means healthcare professional must address in your practice is the way you present your practice to the patients. If they believe that you are always running late, guess what? They will be running late too. So be punctual, they will be punctual. So what is the option? Answer C. Show patients that they can run on time. Means the whole paragraph describes the same option, explains in different ways the same option. And if you understand the sequence, I told you answer is there. See here, must and first. The modal verb as well as the chronological expression. See what needs to be done on the patient's end. Now earlier it was from the health professional's side. Now it is patient side. I told you that is the sequence. From the question as well as audio, you can identify these sequence. So what should be done? Firstly, see first is given here clue. Firstly, the patient must decide that their issue is significant enough to warrant an appointment. Feel that they need a consultation. Find a time and date now. Consider what might be causing their issue. Nothing about causes here. Nothing about date and time. There is nothing, no mention of date and time. Feel that they need a consultation. Patients should first of all feel they need a consultation. That seriousness should be there. Okay. 41. Now weekly representation. Now to bring in efficiency, the Dr. Johnson, what he did, my practice was really struggling from a lack of efficiency. There was no efficiency. So what he did, he started a weekly presentation. Now at the same time, I did not want my patients to feel support. I decided that I would begin to give weekly presentations in the evenings about self-care. As I tended to see a multitude of patients coming in for similar issues that they could actually treat themselves. Each week I focused on a different common theme. The presentations lasted for just 1 hour. And they are asking result of weekly presentation. What happened when Dr. Joseph began giving weekly presentations to patients, awareness programs to the patients? So result they are asking. So result will be always at the end, right? They don't start speaking from the result. First, they will start about the initiation. Otherwise, now this is the effect. Cause will come first, then the effect. So effect will be at the end. The presentation lasted for just 1 hour, but see a contrast is there. Otherwise, nowhere you will find strategies in this paragraph. The first time they put a but, which says there is a contrast. Next part is the answer. I found that they resulted in, see they are asking for result, resulted in 7 fewer. Now there is scale and number together. 7 fewer unnecessary appointments each week. So there were less. Result was less appointments. So which should be the option?
C.
Yeah, clear it is, no? The number of appointments at the practice decreased, means less. Fewer means lesser. Okay, Dr. Johnson was able to work fewer hours? No, he did not work fewer hours. He was working the same hours. The general health of patients was increased? No. With your awareness programs, general health will not increase. They have to act upon it. Last one, about the feeling. Okay. So how does Dr. Johnson feel about use of technology when booking appointments? Thanks to technology says, this is something positive about technology. However, see a contrast. He says all these things. I simply upload instructional videos to our practice website. We also email these videos out to our patients periodically. We can and should make use of technology as a tool in our practices to help us to improve efficiency. However, now the whole scenario changes. It is important to note that while many, perhaps even the majority, see, majority, continuously you have scale C being used here. Majority of your patients will be capable of using technology to arrange their appointments. There are many people uncomfortable, again, scale, or unable to use technology. So you must always make options, make sure that the patients are accommodated to, providing your patients with more options rather than replacing old options. It is often the best practice. Again, you have the scale, the best practice, comparison and scale practice for improving efficiency, which is that instead of replacing the offline one, you have to go offline and online. Now let's move to, okay, that's done. See how these things are given so clearly. If you don't understand, I can highlight and show you those things. See here, when it comes to the answer, you have a contrast here. Then you have, what is it? Scale, majority.
Another scale.
See, the answer clearly it is pointing. saying many, perhaps even the majority, how they stress it is the answer is here. Of your patients will be capable of using technology to arrange their appointments. There are many people uncomfortable or unable to use technology. So you must always make sure these patients are accommodated, means they are not able to use technology, they are not able to take appointment online. So you should also provide offline appointment. The best practice for improving efficiency is to have both online and offline appointment. The best practice. You see, again, you have the scale, right? How beautifully 1, 2, 3, 4, 5 scales. Even here there is a scale. Many, right? So 5 scales directing to the answer. Just with one, however, you can understand the other thing is going to be contrary. Though technology is best, online is best, that itself is not sufficient. So, however, gives a contrast of the previous immediately and work on the same topic, okay, same task. Don't run with other tasks. Now you have to understand, you have to identify this, highlight these things. I don't mind you taking screenshot, but don't use them. You only use it as a reference. Take the audio and try to listen, try to analyze the script by yourself, and let the screenshots be only a reference. Do you understand what I'm saying? Let me stop sharing. Let me stop. This session was mainly because some of them asked for those who have exams on May 7th. They wanted a session on part C. So beginners, if there are some beginners, you might have found it a bit hard because you don't know the strategies that you can find in the previous videos, which is uploaded in our EduSkills channel. Or when we have beginner sessions, we'll go with that. Any other concerns you want to address?
Morning, Father.
Good morning.
My name is Anusijo.
Yeah.
Yeah, I attended the listening part C at Zoom session. It was very clear and crystal explanation together with the transcript. I learned a lot of from EduSkills family. At just I want to say thanks to Father and admin panel.
Okay, you are welcome. You are most welcome. Thank you. You can also suggest if I am going fast or you cannot catch up, or if you don't understand, by which we will understand that we'll have to adopt certain other methods. Yes, yeah, please.
Morning, Father.
Yeah, tell me your name so that I can locate you, okay?
My name is Gigi Thomas.
Okay, Gigi Thomas. Yes, tell me.
Yeah, this is the first time I'm on the Zoom session. Yeah, this is really good. Yeah, I was actually concentrating on the OET speaking. This is really good. Yeah, I mean, the explanation is, it's very clear. I mean, the patience you take to, deal with every line to make us understand. Definitely, that is really appreciable. Thank you so much, Father.
Okay. Yeah. Thank you. You're welcome. You are welcome. Yes. Ultimately, the admin panel and empowering army, they are organizing everything. I just take the sessions. That's all. The whole platform runs because of their sacrifices. I do a small portion with them. That's all.
Hello, Father.
Yeah, please.
My name is Nawab. I am the first time attending your Zoom session.
Yes.
I personally requested you for a beginner class.
Okay, definitely. We will look into next week. You just remind me again, okay? Monday or Sunday.
Yeah. Today, just I am an observer. I can't understand anything. Just gone through your previous videos.
Yes.
Strategies I understand. Today I just kept
Yeah. Today's is an advanced session where we don't even highlight the strategies because I'm not understood. When you ask me second time, I highlighted. And typically the strategies will clearly pinpoint you telling that this is the answer, this is the answer. And most of the answers, no, they are meaningless and nonsense that you can just eliminate. That is the advantage of OET. No other exams like IELTS or TOEFL, those exams give such options. Normally they give all the correct answers, right answers, but one will be correct. Means the golden principle is that give the monkey exactly what he wants. Means the exact answer should be given, the most perfect answer. All will be correct answers, but the most perfect correct answer will be selected. Whereas in OET, you don't have such issues at all, even in writing or reading and listening or reading. And this is the same strategy you have to use for your reading. Only difference, as I tell you, is difference between listening and reading. One, reading, you read and understand the answer, find out the answer. Listening, you listen and understand the answer. Strategies are exactly same. The question sequence, all those things you have to take up. Yeah,
thank you.
Welcome. You're most welcome. Where are you from? You are muted.
I am from Lakshadweep, sir.
Okay, you
That's why I
messaged me in
missed
the
it.
morning, right? One thing you have to keep reminding me, man, because thousands of messages flocking in. I will not be able to scroll and find out. The more repeated messages, I will get it as soon as I look into the phone. Whatever I find with the limited time, I go through them. So even if you spend, for example, yesterday somebody asked me in the previous session, day before yesterday's session, somebody asked me, I'll be sending you one very challenging material. I asked her to mail it. Then the person said, messaged me saying that it cannot be mailed because it is 35 MB. Then I asked her to send it on my WhatsApp. She replied saying that I have already sent. If I have to find, I don't know who is that person. I can't remember all the names, thousands of names. And to find that what she sent 3 days before, I'll have to scroll maybe thousands of messages. But the easy thing, what she can do, she can simply repost it when I ask her. No, so immediately what I do, I send it to my mail so that I can download it and put it in the PPT. Normally, I take the material from your side. Whatever you send it, I take. I don't take select. If I select, I take the official materials. Otherwise, whatever the materials the aspirants say this is very challenging, I take up for the next session. So the basic principle is your mistakes are my syllabus, or your challenges, your difficulties, your mistakes are my syllabus for the next session.
Good morning, Father.
Good morning.
I'm Marina, Father. I'm from Bahrain.
Yes, Marina.
Yeah, actually, I am first time attend the Zoom session today, Father. Because of my duty schedule, I could not attend any of the sessions.
Yes.
And I was really having a tough time with the B part and the C part for both reading and listening. But really, I don't know how to express my thanks, Doctor. Really, it was a great experience. Actually, I was watching your videos, especially in the YouTubes. And after attending the session, this really, it helps me a lot to crack the C part. But my humble request, Mama, Father, is it possible to send a message like inform previous day, because my duty, I need to arrange the time for the Zoom sessions, because today, because of my off duty, I couldn't attend the first part actually. I joined very late.
Normally we put a week's schedule in advance, but now what is happening is that recently we have many people engaged and sick from our admin panel, and people are really so many things, and even empowering army. So we have less volunteers, thereby we are not able to plan. So that's the issue. So the more and more volunteers come to help us. So what we in return, what we ask you to join the empowering army volunteers group. You will be spending maximum 10 minutes or half an hour in a week, which also will be a great learning process for you to assist in the platform. Means learning, it's a learning process and build up your confidence. At the same time, you will be given preferential admission to all the sessions, and you will get personal guidelines or 10 to 15 members groups, study groups. You will have intimate discussions over there, guidance by admin panel, specific guidance. Each group will be in charge, admin will be in charge. So those support system will help us, because it's not easy to carry on a platform with thousands of people. So the more you support, the more time I spend on my, and so that I'm able to give weekly schedule and all those things.
Okay, sure, Father.
And I will also have to find out time to make the PPTs and all. No, that's the issue. Now after giving you the link, I copied all the questions actually and pasted in the PPT after sending the link after 10:30. Yeah, we will look into.
Because Friday and Saturday is only my off duty, that's why.
Yes, yeah. Yes, but then you'll have to look into something like you have even in the application, EduSkills application, you have the assignments, no, day 1, day 2, day 3, day 4. You can go accordingly and update with the self-assessment form.
Sure, Father.
Yeah. And normally, even the videos, I know videos will help you at least maximum 60% of your learning. It cannot be as effective as live sessions.
Thanks a lot, Father. I will contact.
Welcome. You're most welcome. Yes, yeah. God bless you.
Thank you.
Thank you, Father. Thank you, Father, for today conducting special program.
Yeah. You can exit and have your notes. Yeah, please.
Thank you, Father.
Yeah, you have clarified all your doubts in the previous sessions, beginners and all. If you have some concerns, you can speak so that I need not answer in my messages. I can save time over there.
Thank you, Father. Thank you so much.
Yeah, you are most welcome. Rashmi Thomas says.
Yes, Thank Father. you, Father.
Ria, yes,
Good
tell
afternoon.
me. Good
I'm
afternoon.
from Massachusetts.
Okay.
I have little concern regarding the topic sentence, like how we one paragraph you were taken the the first para you would take like it's patient's expectation. How
Yeah.
we can take like we can understand this is the topic sentence we like,
You know how to go to EduSkills YouTube channel, right?
yeah. I'm
There
checking in
there
that,
you go
yeah.
there and type peel, P-E-E-L. Peel means paragraph
Okay.
structure. There are two videos. One is a summary with 2 minutes. Other one is 10 minutes. Two videos that will clearly tell you. It's an IELTS video, but it's same exactly. It will tell you what is topic sentence, where how to identify it, and what is what you call supporting sentence, developing sentence, all those things. Link. P means point, explanation, evidence, or example. Then link. If somebody is familiar with those videos and the paragraph structure videos, you can just post it in the main platform so that they will access it. For others who have seen it. Yeah. All those
Because I
things
was
are
thinking got these points and all. What is the idea behind that? That is why I just asked this. Okay, Father.
And we'll also see to post that what license said one video. Jalajam, you remember? Jalajam or Vinci? That video might help Ria about topic sentence. And
Okay, Father.
yeah.
Thank you, Father. Thank you so
Welcome.
much.
Whatever you find meaningful when you watch, you can send it to the admin, Soumya, so that they will post it in the main platform. No, now you asked for it, but others may not have asked for it. They may not have understood it, so that will be easier.
Good morning,
Done?
Father. This is India from Kuwait. I am also
Yes.
first attending this class today. Thank
Okay.
you, Father, and all admin panel.
Yes.
I want your support for my this one. I booked the date for July because here not getting date. It is very hard to get date. Till December, all the dates booked, so we have to book here. Okay,
Cool, no
Father.
problem.
Thank you.
Yeah, definitely. EduSkills always supports, no issues.
Okay,
only thing we can't study for you. You have to practice. Practice has to be done by you. And we have enough sessions uploaded for all the subtests in the YouTube channel.
I'm watching your videos.
And watch and try to share your experiences over there, no? Even in the comment space. That helps a lot for the people to reach out to the video. The YouTube takes it into consideration. And that will also give you clarity about your learning. Not only that, we will go through them and find out if you have misunderstood something or if you have not understood something. We will it's in the YouTube, it's easy to find out. In the phone, in the messages, WhatsApp or Telegram, you have to scroll a lot. But in YouTube, each video you can typically open it and see the comments and concerns over there easily, anytime. And our signature, you are not sure about our signature, I believe. Smile is our signature. Okay.
Thank you,
Bye-bye.
Father.
Thank you, Father.
Thank you, Father.
Thank you, Father.
Yes. Yeah. Bye. Bye.